Welcome to this module on ONET abilities, specifically focusing on oral comprehension. I'm Dr. Leonard Matheson. Whenever we assist our clients with occupational rehabilitation and career development, it's vital to understand not just what abilities are important for a career, but how important they are and why. Today, we'll dive into oral comprehension, comparing its distinct operating across three distinct occupations: an occupational therapist, a restaurant waitstaff worker, and a neurologist. Our goal is to illustrate how to use ONET's behaviorally anchored rating scales to guide career discussions effectively. First, let's clarify what we mean by oral comprehension within the ONET framework. It's formally defined as the ability to listen to and understand information and ideas presented through spoken words and sentences. This isn't just about hearing, it's about processing and grasping the meaning of what is being communicated verbally. To evaluate its importance for different jobs, ONET provides a numerical value that ranges from 0 to 7. The values are calibrated on a behaviorally anchored rating scale, where a higher score signifies that a higher level of oral comprehension is required in that specific occupation. What's crucial to understand is that we can use these same behavioral anchors clinically to help our clients, colleagues, and other stakeholders do rehabilitation planning. Through behavioral observation and formal testing, we can place our clients' abilities along the same scale as the demands of any target occupation in the occupational information network. It's a very powerful tool, especially for occupational therapists. We'll be using these numerical scores to compare our three example professions. Let's begin with the occupational therapist, identified by ONET code 291122.00. The occupational therapy job requires a minimum oral comprehension bar score of 4.12 out of 7. This relatively high score reflects how critical listening and understanding are to their daily work. Consider their core tasks. They must gather information and assess clients by deeply listening to patients describe their conditions, their daily challenges, and their goals, as well as absorbing details from family members and other healthcare providers. This isn't superficial listening. It requires comprehensive understanding. Several skills heavily tied to oral comprehension are essential in these tasks. Active listening is paramount, giving full attention and taking time to understand, asking pertinent questions without interrupting. They also need social perceptiveness to interpret verbal cues and understand why people react as they do, which is crucial for building rapport and effective therapy. Other key skills include critical thinking, where they must fully comprehend verbally presented information to logically identify solutions, and problem sensitivity, recognizing potential issues by understanding symptoms or concerns. In terms of work activities, an occupational therapist constantly communicates with supervisors, peers, and subordinates to ensure aligned patient care. They must establish and maintain interpersonal relationships by genuinely listening to clients and colleagues. Furthermore, they often interpret complex medical information for others, first by having a strong grasp of it themselves through listening, and then translating it for clients and families. All of this feeds into their ability to make decisions and solve problems, as a solid understanding of the verbally presented problem is foundational. As you can see, oral comprehension is very deeply woven into the fabric of this profession. Next, let's consider a restaurant waitstaff worker, ONET code 35-3031.00. Their oral comprehension bar score is 3.00. This is lower than the occupational therapist, but still indicates that oral comprehension is an essential aspect of their job. The very nature of their role implies these direct dependencies on understanding spoken information from customers. To be successful, they must appreciate preferences and nuances in their customers' requests and orders. They must listen for and understand questions regarding the menu, a level of ability that directly impacts their earnings. This is especially true when there is a criticism about the meal or a misunderstanding about the bill when it comes time to settle up. For work activities, restaurant waitstaff workers are constantly getting information from both customers and coworkers. Their role revolves around performing for or working directly with the public, which requires a continuous ability to comprehend what customers are saying, whether it's an order, a question about the menu, or a request. They must also quickly and effectively communicate with supervisors, peers, or subordinates, providing and receiving instructions or information from various team members. And when issues arise, Resolving conflicts and negotiating with others, such as handling a customer complaint, relies on a strong ability to listen to and understand the customer's perspective to find a solution. So while the complexity of the information might be different from a medical setting, clear and accurate oral comprehension is still foundational to their success. Finally, let's look at the neurologist, ONET code 291217.00. This occupation has the highest oral comprehension bar score among our examples, a remarkable 5.50. This indicates that oral comprehension is absolutely critical to their core job functions. Consider their tasks. Neurologists frequently provide training and supervision, explaining complex medical procedures and care plans to students and staff. This demands a very high level of oral comprehension to ensure the information is absorbed precisely and without error. They are also constantly engaging in continuing education, attending lectures and seminars where absorbing spoken information is key to staying current with cutting-edge research and treatments. They also assess cognitive function by listening intently to a patient's speech patterns, fluency, and content to identify potential language disorders or other neurological deficits. Their work activities further emphasize this. Neurologists are deeply involved in collecting medical information by actively listening to patients describe their symptoms, their families provide medical history, and other medical professionals share insights crucial for accurate diagnosis. They must also effectively inform medical professionals during verbal rounds and consultations, conveying precise patient details. A neurologist's role also involves communicating detailed medical information to patients and their families, explaining complex diagnoses and treatment plans, which requires first developing a precise understanding of their audience's comprehension level and concerns. Lastly, advising patients on health conditions means listening carefully to their fears and questions to provide empathetic and effective counseling. For a neurologist, a high level of oral comprehension is not just important, it's fundamental to patient safety and effective treatment. Looking at the ONET data bar scores side by side, we see a clear spectrum of importance for oral comprehension. Neurologists at 5.50, occupational therapists at 4.12, and restaurant waitstaff at 3.00. This isn't just a random difference. It highlights critical distinctions in these roles. The primary factor driving these differences is the complexity of the information being communicated orally. For a neurologist, understanding subtle verbal cues from a patient or complex medical jargon from a colleague is significantly more intricate and technical than understanding a customer's order. Secondly, consider the consequences of miscomprehension. In the medical field, a misunderstanding can lead to incorrect diagnoses or ineffective treatment plans with severe implications for patient health. For waitstaff, while miscommunication can lead to an incorrect order or customer dissatisfaction, the stakes are generally much lower. Lastly, the depth of interaction plays a role. Occupational therapists and neurologists engage in long-term diagnostic and therapeutic relationships that demand a profound and continuous understanding of spoken information to build trust and provide effective care. This comparison vividly illustrates how the level and context of an abilities requirement vary across occupations. So, how do we apply this understanding in your role assisting clients with occupational rehab planning or career development? The most important takeaway is that cognitive abilities like oral comprehension are not one size fits all. Simply knowing that a job requires oral comprehension isn't enough. We must help clients understand the nuances, how much of that ability is needed, and in what specific contexts it will be applied. ONET's bar scores provide a powerful tool for this. We can use these scores to identify alignment. If a client has strong oral comprehension, you can point them towards careers where this ability is a significant asset. Pinpoint development areas. Conversely, if a desired career requires a higher level of oral comprehension than a client currently possesses, you can help them identify this gap and work on strategies to develop this crucial ability through practice, training, or relevant experiences. Identify potentially useful workplace accommodations. I've had a lot of success helping my clients with problems like receptive aphasia develop strategies to work around or minimize the oral comprehension requirements of a job that they've held for many years. There are a lot of workarounds possible if we put on our thinking caps and exercise our creativity in concert with our client's desire to go back to work. Ultimately, this approach helps us facilitate informed rehab planning and career choices, empowering our clients to pursue paths that leverage their strengths or to intentionally build the skills necessary for their desired future, all grounded in objective, behaviorally anchored data. Thank you for your interest in this wonderful tool that is especially attuned to occupational therapists' contributions to rehabilitation planning and career development. If we can help you in improving your knowledge and skills in this area, please reach out to us at mathesondevelopment.com.